In recent years, there have been significant gains in the health of women globally, in large part because of the major focus on reducing maternal mortality and morbidity. As a result of the successes of those campaigns, the burden of disease for women has changed quite dramatically, such that now non-communicable diseases are the leading causes of death and disability for women. Continued focus on maternal mortality and disability means we're focusing only on those women who choose to have children. So those women who choose not to have children or can't have children, or women who have passed their reproductive years, the agenda, if it just focuses entirely on maternal mortality, is not addressing the needs of those women. We're calling for the United Nations and other United Nations agencies such as the World Health Organization to take the lead in ensuring that resources are put into reducing the burden of non-communicable diseases in women. Already those agencies recognise the importance of non-communicable diseases in women, but the resources are not following, and they do need to follow. The second focus of the paper is on the need to change the way in which we collect data and undertake research. We're starting to realise that health systems respond in different ways to women and men, and that disease impacts differently for women and men. So if we really want to address the women's health agenda, we must ensure that when we look at health data, we look at separately for men and women, and we must ensure that when we do scientific research, that we must include women in studies, and we must analyse the data that we've collected separately for men and women.
If we take, for example, cardiovascular disease, which is commonly thought of as a men's disease, actually it's the biggest killer of women worldwide. There's plenty of evidence to suggest that the way that women present with cardiovascular disease is different from the way men present. The symptoms are generally different. And also the progression of disease tends to be different between the sexes. Despite this, current guidelines are based almost entirely upon data, evidence from men.
Women tend to develop stroke more commonly as compared to men. And the onset of cardiovascular disease is generally later in a woman's life as compared to men. We also know that some risk factors, such as smoking and diabetes, are more potent in women as compared to men. The symptoms that a woman presents with are often considered to be atypical, and it could therefore be that a diagnosis is being delayed or actually even missed. And a misdiagnosis would lead to either undertreatment or no treatment at all, which subsequently also leads to worse prognosis and worse outcomes in women with cardiovascular disease.
Our goal in producing this paper is to ensure that as a result of our recommendations, we can improve the health of the maximum number of women possible. And the way to do that is to ensure that we address the issues that are of most importance to all women globally. And if the leading causes of death for women worldwide are non-communicable diseases, then it just makes so much sense that we focus the global women's health agenda on non-communicable diseases. Of course, we must continue to have a focus on reducing maternal mortality. We must focus on women's sexual and reproductive health, but integrating that focus with a very important focus on non-communicable diseases in women is going to be essential.